Uh, uh, well, let us start with the second session of the day, which is on medical knowledge and preventive care in the Indo-Islamic world. As you know that there are three presentations to be made. There are, in fact, three presentations. One by Dr. Farooq Ahmad, another by Professor Mohammad Akram, and the third by Professor Ashhar Qadeer. Now, I request, would you like to speak first? Farooq Sahab? So I would like to request Dr. Farooq Ahmad to speak on medical texts and Mughal India, production, knowledge, and legacy.
Greetings, everyone. Well, at the outset, I would like to thank the organizers, especially Professor Farad Saab, for giving me this opportunity to be among the great historians here. So this is the first time I'm joining a conference of history of medicine. Yeah. This is my medical manuscripts. He's checking. So my topic is about the medical manuscripts or medical texts of the Mughal era. In order to understand the development and production of these texts, it's pertinent to understand the medical systems that were prevalent during that period. So we basically had three major medical systems prevalent that time. Number one was the Chinese medicine, which was being practiced in China, mainland China, and it was very localized. It was practiced only in China that time, though there had been some interactions between the Chinese medicine and the Central Asia through Silk Road, but that is not of much significance. Only I can remember is the one therapy from Chinese medicine, that is cupping therapy, which may have been transferred from Chinese medicine to the Central Asian medicine. So second slide, please. Another medicine was Ayurveda, practiced mainly in the North India, and it was also only practiced in the Indian subcontinent, though there were interactions between Ayurveda and the Central Asian medicine. Second slide, please. The third medicine which was prevalent that time was known as Tib, which we now know it by the name of Unani medicine or Unani Tib. So Tib was a medicine, and this medicine basically originated in Greece, and then it shifted to the Arabs. And this Tib was prevalent not only in Arabian Peninsula, whole Persian Empire, but also in the Europe. Even up to the 15th century, this medicine was being practiced. The previous slide, please. This medicine was being practiced in the major portions of the globe. So we can say that this Tib. Okay. So it was comparatively global as compared to the Chinese and the Ayurveda. So for the students of history here who have the interest in the medical history of medicine, let me give you a brief overlay of the history of this tip. So we go back to the Egyptian period. This is the period where we have a documented history of medicine. So as you all know, Egypt, we have papyrus. In papyrus, certain medicines were there, like olibanum and myrrh, which were used for cardiac ailments, heart diseases. But the medicine at that time was, a mixture of the real medicine as well as the superstition. Like the demons and the evils were being considered responsible for the disease. Then comes the Greek period. I think it was a significant period in the history of medicine. It roughly starts at 500 BC. This is the period where medicine, actually, was converted into a science. Main, philosophy, logic, even some experimentations and observations. On these basis was the medicine, and medicine was freed from superstition in this period. And Hippocrates was the popular figure, also considered as the father of medicine. Hippocrates, and then the Galen and other people. So this was a period, and one theory emerged here for disease and health. That was the humoral theory. It was considered that the body, is the balance of four humors, and when these four humors remain in balance, the health exists. And if there is a derangement of these four humors, imbalance of these four humors, then there will be a disease. With the decline of the Roman Empire, Greco-Roman Empire, the cultural drift moved towards the east, to the Arabs, because Islamic empire was growing at that period. So this medicine reached to the Arabs through Syriac scholars. They did the translations, mainly the Syriac scholars, and it reached the Arabs. Arabs did two things. Number one, first they did the translations for their own understanding, but indirectly what they did, they preserved the Greek knowledge. And you may be astonished to know that whatever the knowledge we have about Galen this date, it's through the Arab translations. No original Greek version of Galen is available. So one thing was translation and preservation of knowledge. Second, they did their own additions to this knowledge. Besides humoral theory, they developed one parallel theory called the theory of Mizaj, though it was found and traces in the Hippocratic or Greek medicine. But they developed this Mizaj and applied it to the diagnosis, treatment of the disease. So it was a very significant period, Arab medicine. Then comes the 17th century onwards until 19th century, when the germs were discovered and a new medicine evolved, which we now know as modern medicine, Western medicine, or allopathic medicine. But this was the evidence-based medicine because we can see the germs. But still then, this medicine, this humoral medicine, which started from Greek and which was with the Arabs, didn't vanish. It continued, and it reached the India through during the Sultanate period mainly, but it was promoted in India during the Mughal period mainly. Because I'm speaking about the Mughal period, I will stay with that period. Next, please. Okay, sorry, I will do it. So in brief, this TIB or Unani medicine is basically a Greco-Arab Persian Indian amalgamation. So whenever I use the word Arab medicine, please consider this in Arab as well as Persian medicine, because Persians also did a lot of contribution in it. Because just because the main texts were in the Arabic language, so it's called by historians as Arab medicine. Otherwise, it is the Arab and Persian medicine. And also, it reached India. Here, also the Indian Hakims and other people also developed it. So it's an amalgamation of Greco-Arab Persian medicine. Initially, it was called as Tib. Tib means medicine. It's an Arabic word. Tib, it means medicine. And later it was termed as Unani medicine, owing to its origin, because Unani means Greek. So most of the medical texts which were developed during the Mughal period, were from this medicine, not Ayurveda, though there were some translations done of the Ayurvedic texts, but mainly the medical texts which were developed during the Mughal period were belongs to this system of medicine called the Unani Tib. And this medicine is still being practiced in India and also in other countries as well. So this medicine is like a living fossil for paleontologists, because when you people study these medical texts as historians, most of these books are part of our curriculum. So we study and practice these texts even to this day. And on the lighter note, we are just feeling like this dinosaur in a paleontology conference. उधर point करो इधर. Okay. हो गया. Direction किस तरफ? इधर आपकी तरफ. Okay, okay, no issue. So I'm today happy to see a lot of historians interested in this medical history. Few years back, I was looking for some historian who was interested in this history of medicine in Aligarh. And I talked to one of my colleagues and he couldn't name one. I don't know what was the reason. So, but now today in this conference, I'm happy that there are many historians who are interested in the history of medicine.
Farooq Saab, your 5 minutes are over. So
No, I will finish within 20 minutes, sir.
You have 15 minutes. Sorry.
15 only?
Yeah.
Okay, sir. No issue. So when historians look at the medical history, they have a different perspective. Their main concern is historiography, philosophy, philological concerns, provenance of the manuscripts, textual scrutiny, or cultural or social parameters. But as a medical student, when we look at the history of medicine, we look at through a different perspective. Like we look at the validation, scientific validation. We look for the relevance in the current times or any future relevance which this text can have. So my apologies if I don't, touch any of these aspects. No matter how hard Professor Faraz have tried to bring me closer to this historical perspective. Okay, now Mughals in India. There was already a system existing here, as I already told you, Ayurveda. So when already a system was there, but still Mughals brought their own medical system here, probably they had more faith in that system or they were used to that system, or it was just like, whenever a conqueror comes to another place, they bring their own culture, language, and medicine. So these were the reasons. And one issue they faced here, because of the different phytogeography, the herbs available in Central Asia, which were they using in that medicine, some of them were not available in India. And another thing was some new herbs which were being used in India, they were not being used by these hakims or physicians at that time. So the main challenge for them was to get these new medicines incorporated into their own system. So if you look, some new herbs which they found here was the neem, ashoka, even new drug preparations like basma, which was specifically used in the Ayurveda, was not prevalent in Unani medicine. But Unani medicine adapted this, and now it's called as Kushta in Unani medicine. So next, okay. But this transmission was bilateral. Even the Ayurveda learned something from Unani. Many herbs, the list is here, which were not there in Ayurveda, but they were taken from the Unani medicine. Similarly, certain procedures like Sir yesterday told, the examination of urine, pulse examination, even the preventive measures which was used in Greco system of medicine is called as evacuation. I will discuss it later. So this came into the Ayurveda, and today the Panchkarma technique, which is used in Ayurveda, very popular technique, 4 of its components are from Unani system of medicine. Though there were some earlier interactions before Mughals or Sultanate period, during the Abbasid period, they invited Indian scholars to the Bureau of Translation, which was in Baghdad, the House of Wisdom, Baitul Hikmah, everybody knows it. So Abbasid caliphs, they invited scholars from India for translation of Sanskrit works. Many Sanskrit works were translated on astronomy, mathematics, but medicine was also translated, medicinal books. And a very popular person, Manka, also known as Malka al-Hindi, he was court physician to the Harun al-Rashid. He was appointed as the in charge of these translations. Similarly, the Shushruta, the classic text of Ayurveda into Persian was translated. It was before the Mughals came or the Sultanate period. And one manuscript which is known as Boer manuscript, very important for Indian medicine. It was found in northwest China, means the Turkestan China. So a link between Central Asia and this Indian work. In Mughal era, two important things. One was the migration of the medical men, though it started before the Mughal period, during the Sultanate period. And even before that, when there was Mughal invasions there, people migrated to India. And during Mughal period, they received the highest patronage. They were given many titles. Even some became governors, some physicians, some even became ambassadors. They were given Panch Hazari like title. That was the command of cavalry of 5,000 people, 5,000 horses. And many come to the Mughal court for lucrative salaries. So medical texts mostly belong to the Arab medicine, as I already told you, though there were some translation of the Ayurvedic texts. The most of the texts during this period were Persian, though there are many Arabic translation also. Arabic, initially, the books were written, the medical texts were written, they were in Arabic language. And from the Akbar's period onwards, the Persianization of this system was done. Many books were written in Persian language. Arabic was the language of the elites, and Persian was of the common masses. And this was one of the reasons when this medicine was shifted from Arabic to Persian, it leads to its popularity, because it was the language of common men and many people could learn and do this medicine. And as I already told you, mainly the books were on pharmacology and pharmacopoeias. And here is a list of pharmacopoeias. Pharmacopoeia is basically an official document. Even today, pharmacopoeias are written. There is an Indian pharmacopoeia, British pharmacopoeia. Pharmacopoeia is an official document which lists the drugs, their uses, and how to use, dosage of that drug is given. So these are these Karabadins which were written during this period. Karabadin Qadri, very important. Mujarrabat Akbari, Tajul Mujarrabat, Karabadin Kabir, Ilajul Amraz, Karabadin Bakai, Karabadin Zakai. I have listed only few texts, not all the texts, though there have been many texts written during this period. I have only listed few for your interest. During the Emperor Babur, very important Hakim, Muhammad bin Yusuf Harawi, he came to India 1526 along with Babur from Herat, and this is the publication Bahrul Jawahar. It's basically a medical dictionary. At that time, there was no tradition of writing a dictionary. Even in previous records, we don't find a medical dictionary, but this was the first guy who wrote the medical dictionary, and it has been published by different publishers from time to time. Very important book, Anul Hayat, by the same author. It was written in 1532. This book is on geriatrics, means the diseases of the old age, old people, geriatric, and longevity, means how to prolong your life. It includes 99 herbs, preventive measures, including evacuation, that we'll discuss later, exercise and diet. Its Urdu translation was done in 2007 by Professor Sayyidul Rahman at Legat.
I'm sorry, Dr. Farooq, can you hurry up?
Just 2 slides more.
Right.
So during this was during the Emperor Humayun. Then during the period of Akbar, Hakim Ali Gilani, very important physician, he wrote Sharh Qanun. Qanun is the book of Ibn Sina, Canon of Medicine, and Sharh means commentary. The commentary was written by this Hakim Ali Gilani. This was the second person to write the full commentary of the Al-Qanun. Earlier, it was written by, as I remember, probably Karshi, Alauddin Karshi. This was the second person. Then another important Hakim Anul Mulk Shirazi. He wrote the Fawaidul Insan about the single drops and foods. on the request of Akbar. Then during Emperor Shah Jahan, Amanullah Khan, very important, Hakim, he wrote Ganj Bad Aurat, it's again a pharmacopoeia, and a Karabadin Darashkoi, again a pharmacopoeia. Hakim Masum Khan, Karabadin Masumi. Emperor Aurangzeb, Hakim Ali Khan, very important figure during this period, he wrote these 8 books. Now, because this focus of this conference is on preventive medicine, so I have just listed the books specific to the preventive here. So about 10 books are here, which are specific to the preventive medicine. Now, if you look at the knowledge content, almost every topic of medicine, which was prevalent that time under the sun, was included. But here I have given only where a specific book was written on a subject. So these are the books on the specific medical subject. You will find the subjects like medicine, pharmacology, pharmacopoeias, preventive medicine, wellness and longevity, geriatrics, pediatrics, and ophthalmology. Let me, reiterate this point that for the past one day, we had a discussion on preventive medicine and curative medicine. In Unani medicine and even medicine today, there are 3 aspects. One is the preservation of health. When you are healthy, you preserve that health. That is called wellness. Second is prevention, that is to prevent the disease. And third is the treatment of the disease. So in Unani medicine, these 3 concepts are separate. Concept of wellness, prevention, and cure, that is treatment part. So even ophthalmology was also covered. Now, this is my last slide. I would like to take 5 minutes, sir, if I have.
1 minute. Sir.
1 minute, no issue. So this is the concept of prevention prevalent in this system of medicine, the books which found during the Mughal period. Now, in Unani medicine, basically the prevention is based on the moderation of asbab-e-sitta zaruriya, which are called as 6 essential factors. These are the 6 essential factors which are, advised to be kept in moderation, like the air, that is the ambient air, then foods and drinks we eat and drink, physical activity and rest, mental activity and repose, sleep and wakefulness, evacuation, elimination, and retention. So if we look at these 6 essential factors, apart from the evacuation component, rest depends on the patient. So they have to be, done by the patient himself, activity or whatever, sleep. Only some techniques are there to induce the sleep, to get the better sleep. But mainly what the treatment part including this prevention was the evacuation. This is the major, preventive aspect in Unani medicine. So evacuation means evacuation of the morbid matter, the disease causing matter from the body, for which there are different techniques used. This is the last slide, sir. Yeah. One technique is by pharmacotherapy, by giving the herbs. That therapy is called as Munzij and Musil. And another technique is non-pharmacological, which is called as regimenal therapy, in which you will find Kai, that is induced vomiting, then Ishal, purgation, Hammam, Turkish bath. Let me emphasize this point. Hammam was not just for cleaning the body. Hammam basically is a technique of evacuation by causing the sweating. It was believed that by sweating, many toxins are removed from the body. That's why in those hammams, there was first a hot chamber in which patient was kept and he perspires a lot and those toxins were removed. So hammam was not for cleaning purpose, but for the evacuation purpose. And then fasad, last 3 techniques are by removing the blood from the body. 3 techniques, especially one is bloodletting. Cut is made into the vein of the body anywhere. Then hijama, cupping therapy, probably from the Chinese medicine. And then last is the leech therapy. Leech are applied on the body. This is a worm which sucks the blood. So this was the major, preventive things prevalent in the, this Greco-Arab medicine during the Mughal period. So thank you. Because of shortage of time, I have to make it fast.
Thank you very much. I'm sorry. Your paper was really very interesting, but unfortunately, there is a shortage of time. And I also wish that I would have met you in Liga itself, but I'm meeting you here thanks to Faraz Saab. I invite Professor Mohammad Akram Saab from Jamia Millia. Sure enough. Please go ahead.
Thank you very much, Raksa. First of all, I am thankful to all the organizers to invite me here in the galaxy of historians. But fortunately, I am the only person directly related to preventive healthcare. I am professor in community medicine, that is directly working for prevention of health and prevention of diseases as well. So the topic of my presentation today is preventive healthcare in Indo-Muslim medical tradition in South Asia, 16th to 18th century, with a special reference to the contributions of Yusuf al-Harawi, commonly known as Yusufi. Can you change the slide? No, you change yourself. Oh, the Indo-Muslim medical tradition in South Asia flourished under the patronage of various Muslim analysts, reaching in the zenith during the Mughal era, 16th to 18th century. This period witnessed significant advancement in medical knowledge, including both curative and preventive healthcare practices. Among the eminent physicians of this time, Hakim Yusuf bin Muhammad bin Yusuf al-Harawi, known as Yusufi, a distinguished scholar and practitioner who migrated from Herat, Persia, to India with the entourage of Emperor Babur in 1526, serving as the personal physician to the Babur and later Humayun. He has worked in the period of Babur itself and to the Humayun also. Yusuf contributed extensively to the medical literature of his time. This study explores Yusuf's contribution to the preventive healthcare, particularly through his works, importantly Risala Maqul Mashroob, Sitta Zaruriya, and Qasida Dar Hifz Sehat. Maqul Mashroob is the important part included in the Asbab Sitta Zaruriya, six essential prerequisites to maintain the health. And also in the name of Hifz Sehat, that is also related to the Asbab Sitta Zaruriya, which reflect the expertise in dietary regulations. Dietary regulations is important part nowadays also, as lifestyle management, we modify the diet. But in case of Unani medicine, the concept of equilibrium in the humors. So correct type of humors comes from the correct type of diet. So diet management is very important for the preventive health care. So, and the fundamental principles of the health preservation, his poetic rendition of the preventive and medicine wisdom in Qasida Dar Hifz Sehat further underscores the integration of literary and scientific traditions in Indo-Muslim medical heritage. As far as the Babur is concerned in healthcare system, the brief yet significant reign of Mughal Emperor Babur in India 1526 to 1530 was marked not only by military conquests and statecraft but also by the engagement with the cultural and scientific life of the time. Babur passed away on December 26, 1530, after ruling of 5 years. Upon his arrival in India, he inherited a landscape where medical institutions, particularly hospitals, were already functioning with notable organization. Major urban centers hosted hospitals that employed physicians and support staff on salaried appointments, indicating a well established healthcare system infrastructure in India. Babur's own interest in the healing art is well documented in his memoirs, the Babur Nama. These writings, particularly him as a man of the broad intellect, fluent in Turkish, accomplished poet in both Turkish and Persian, and someone evidently conversant with the medical practices. His knowledge is illustrated by the personal episodes of involving an attempt on his life by poisoning, allegedly orchestrated by the mother of Ibrahim Lodi. The remedies he employed in himself, including milk, gule makhtum, rose water, and antidote tiryaq Farooq. Tiryaka Farooq, very important compound Unani formulation used for the treatment of many type of poisonings. So he used himself, whether on advice of certain Hakims or himself. The incidents revealed Babar's familiarity with the medical substances and treatment protocols. Now come to the Hakim Yusufi. Among the notable medical figures of Babar's era, one name stands out prominently, Hakim Yusufi. His work and legacy provided an invaluable window into the medical thoughts and practices of the early Mughal period. Hakim Yusufi's life and contributions. Yusuf bin Muhammad bin Yusuf Al-Harwi, known by his pen name Yusufi, was one of the most distinguished physicians of the early Mughal era, serving at the courts of the both Babur and the successor Humayun. Yusufi played a pivotal role in the shaping of the medical literature and practices of the time. His scholarly output, written predominantly in Persian, reflects his mastery of the both language and medicine. The introductory verses of his work, Fawaizul Akhyar, are particularly illustrative of the intellectual depth and poetic flair. In these lines, Yusufi succinctly articulates the core philosophy of the Unani medicine. In Persian, he writes, Gharz astib do cheez amada ast, Bashanwar Yusufi basama raza, Hifze sehat yaki aza bashud, Digari dafai illate marz. The art of the medical has two main purposes. Listen to Yusufi with the ear of acceptance. One is to maintain health, the other to eliminate the illness. As earlier it was discussed that preventive medicine and curative medicine are the both side by side running in the Unani medicine. Learn from me if you wish to grow the healing, remove early disease through its opposite, maintain health through similarity. These are the two component Ilaj bil Misl and Ilaj bil Zid. This concise poetic summary encapsulates the principles that are otherwise expounded across volumes in Unani medical literature. Yusuf is credited as the first Mughal era physician to systematically compile and organize medical texts, leaving behind a substantial corpus of work. Next, please. Major works of Hakim Yusufi, particularly in the field of preventive healthcare. One is Qasida Dar Hifz Sehat, Poem on Health Preservation, a poetic treatise incorporating Hindi vocabulary. He used Hindi terminologies also in his poems, reflecting Yusufi's engagement with the linguistic diversity of the religion. Copies preserved in Khuda Bakhsh Library, Patna, AMU Aligarh, and Raza Library, Rampur. Next, please. Another important work of Yusufi include Fawaizul Akhyar, Benefits of the Righteous, a small manuscript, 24 pages script, written in 1570, dedicated to the preservation of health. Hifz Sehat. This is the important importance of this manuscript, that it is completely dedicated to Hifz Sehat, held at Osmania University Library, Hyderabad. Another important work in preventive medicine is Risala Maqul Mashroob. As Farooq Sahab was also telling, that Maqul Mashroob is the important part of the preventive healthcare in Unani medicine, including the second component of Asbab Sitta Zaruriya. So this Risala is completely based on Maqul Mashroob, a Masnavi style poetic collection describing dietary regimes preserved in libraries including the Salarjung Museum, Hyderabad, and Raza Library, Rampur. Jamiul Fawaid is also important composition of Hakim Yusufi, a detailed commentary on Ilaj al-Amraz written at the request of the readers. The engaging style and detailed exposition make a valuable educational resource. Copies exist in the numerous institutions, including Khuda Bakhsh Library, AMU Aligarh, Raza Library, Nizamiya Tibbiya College, Salarjung Museum, Asiatic Society of Bengal, and it is also available in Jamia Hamdard University manuscript sections. Sitta Zaruriya, as the name suggests, it is based on the Asbab Sitta Zaruriya, a didactic poem expounding on the 6 essential principles of the health maintenance, attributed to the Humayun and preserved in various Indian manuscript collection like Asiatic Society of Bengal, AMU Aligarh, Raza Library Rampur, Andhra Pradesh Manuscript Library, Salarjung Museum, Hyderabad. Another important work of Yusufi Riyazul Adviya, Practices of Medicines, a pharmacological text on simple and compound drugs reportedly associated with Emperor Humayun. Multiple copies are extant in major repositories like Khudabakhsh Library, Asiatic Society. Why I have included this manuscript in this in the preventive healthcare? Because in Unani medicine there is a concept of Muqawwiyat. There are certain drugs, whether compound drugs or single drugs, which are used to strengthen the body. As we have seen in recently in case of COVID-19 pandemic, we have used Khamira Marwarid very extensively to strengthen our body. So such type of drugs are included in this manuscript, so that it is the important part of preventive healthcare also. Aslul Usul is the another important work of Yusufi preserved in the Maulana Azad Library, Aligarh Muslim University. Manuscript number is there. This rare 16th century manuscript, copied in 1839, outlines regulations for physicians and underscores the professionalization of medical practice. Dalail-e-Bawl, sign of urine, focuses on the diagnostic techniques based on the urine analysis. This work is housed in the several libraries, including Khudabakhsh Library, Patna, Asiatic Society, Bengal, and Salarjung Museum. Though it is based on the diagnostic in Unani medicine, but why I have included this in the preventive healthcare? Because early diagnosis is the leading thing to cure the disease as well as to prevent the ill effect of the disease. So there are certain diagnostic techniques which are mentioned in this book, which from which we can assess the deviation of humors. If we can achieve the equilibrium of humors, the disease will be eliminated, and we can have the health itself. Yes. Dalail-e-Nabz is also included, though it is based on the assessment of nubs, but it is also for the assessment of deviation of humors. The complementary diagnostic manual concentrated on pulse examination. Copies are extant in the British Museum, Maulana Azad Library, and other prominent collections. Ilaj al-Amraz is also included in this category, comprising 982 treatment entries. This compendium addresses a wide range of ailments. Copies are available in institutions such as British Museum and Raza Library, Rampur. Legacy and influence. The majority of Yusufi's writings focus on the prevention of health, a central concern in Unani medicine theory. His efforts helped popularize foundations and health principles among both the general populace and the ruling elite. Notably, the elaborated on two core therapeutic documents. One is Ilaj with Zid. Illness are treated by the employing substances or methods that are counteract the symptoms. If the symptom of the disease are hot in nature, so we have to apply the drugs or procedures which are cold in nature. Similarly, Ilaj bil Misl is also important in strengthening the body or restoring health by using eliminate similar in nature to the patient's condition. So it is the strengthening of the equilibrium of humors. To conclude, the medical legacy of Hakim Yusuf al-Harawi as stand as a testament to the sophistication and holistic approach on the Indo-Muslim medical tradition during the Mughal era. Through this pioneering focus on preventive healthcare, Yusufi not only preserved and disseminated the principles of Unani medicine, but also enriched them with the uniquely Indo-Persian synthesis of the science, literature, and spirituality. His extensive body of work from Risala Makul Mashroob and Sitta Zaruriya to Qasida Dar Hifz Sehat demonstrates a comprehensive understanding of health preservation, emphasizing balanced nutrition, regulated lifestyle, and early diagnosis by crafting his knowledge into accessible poetic forms and structured treatise. Yusufi effectively communicated medical wisdom to both scholars and laymen. Yusufi's contribution reflects a broader intellectual environment in which preventive medicine was not only the practice but also revered as a critical pillar of the healthcare. His work bridges multiple cultural and scientific traditions, Persian, Central Asian, and Indian. And this influence underscores the value of the integrative preventive models of the health and remain relevant. The study reaffirms the historical depth of the historic wellness and concepts and underscores the needs of the visits of traditional framework that emphasized maintaining health as much as curing disease. Through the lens of the Yusufi's scholarship, the enduring relevance of the preventive healthcare in complementary discourse becomes both apparent and inspiring. Thank you very much.
Thank you, Prof. Akram, for keeping time. You took exactly the time which was allotted to you. Now I request Professor Ashhar Qadeer Sahab to make his presentation on Indic influences in Unani texts of medieval period.
Very good afternoon to everyone. First of all, I would like to pay my thanks to the organizers of this event and the chair to allow me to present my paper. As you are seeing that the title of my paper is that Indic influence in Unani medical text of the medieval period. Please show in the full slide. A case study of Madan al-Shifa Sikandar Shahi, that is the name of the book. And you know that the Madin Shifa Sikandar Shahi means, Madin means mind, and Shifa means recovery from the disease. So this type of book has the text that by going through, you will find a mind of recovery and the healthy tools. So back, it is very common. First of all, we have to give an introduction that it was invented in Greek and so on. And that's why with the amalgamation of the Hippocratic and followed by the Galen, the name was introduced as Greco-Arabic at that time. Next slide. It is very important slide that we know that it was emerged at Greece and developed by the Galen and the Persian, and they entered in India in 12th century. But now at present, it is being used as the indigenous system of medicine. This is the point of thought that why it is known as the indigenous system of medicine, and by the ministry, it is also patronized by the name of the indigenous system of the medicine. So this is very important. And you can see that the presently in India, indigenous system of medicine are governed by the Ministry of Ayush, Government of India. And Ayush stands for the Ayurveda, Yoga, Naturopathy, Unani, Siddha, Swarikpa, and Homeopathy. Next slide, please. It is self-explanatory because I have made the important lines with the red color. You can say, though this system is in connection with the India since 8th century, but came into practice during 12th and established around 14. Unani system of medicine has a unique character of preserving its basic fundamentals with approval of new, advanced, and progressive information. Wherever it sets up, it integrates with the beneficial healing assets found at that particular place. So this is its importance. And there are no intensive restrictions to intact clinical distinctiveness. This superiority of Unani medicine converts its foreign character into national for every venue. The same happened to it in India, and it has become indigenous. Bharatiya Chikitsa Paddhati. Next. Now, the points of my presentation are Unani medicine tradition in medieval South Asia and highlights to its malleable and flexible nature. Number one, how it may become indigenous. The second one is Unani was an active medical tradition in constant conversation with the indigenous medical practice in India. Some of the Unani physicians known as Hakims even learned Sanskrit to consult Ayurvedic text and understand Indian medical practices. Not only Unani physicians consulted ancient Indian medical texts, but also translated them into Arabic and Persian languages to introduce Indian medical thesis along with the practice bunch among the practitioners of Greek oral medicine. Some of these texts are still extant and preserved in different archives and libraries of India. One of such texts is Madin al-Shifa Sikandar Shahi, written around 1512 by an Unani scholar and physician of that time, Bahwa bin Khawas Khan. This slide is very important because beside this book, I have sorted out 13 books, 12 books. Even the tally goes up to 17 in my knowledge. There may be more, but these are the books which I have sorted out. These books have the same nature as Madin al-Shifa Sikandar Shahi is, because these are the translators, introductions who looked into the indigenous systems, indigenous medical text, and to understand the venue and the practical modes, they want to elaborate their own system, their own people, by the conservation of the peoples and the assets of the practice. So these are the books you can see, Kitab al-Shifa, so on. So book number 5 is Madun al-Shifa Sikandar Shahi by Bahwa bin Khawas Khan. And I had also presented many papers on previous books. So this is the books which solves the purpose of Indic influence in Unani medical texts of the medical period, a case study of Madin Shifa Sikandar Shahi. This is the slide. You can say that it shows the period, the writer, the patronage. Lodi was the dynasty at that time. Previously, it is known as Lodi, but it is also pronounced as the Lodi. And you can say that Lodi dynasty, the period was there. The first king was Belol, the second was Sikandar, the third was Ibrahim, and the second Sultan Sikandar Lodi has its assistant as well as the court physician known as Bahwa bin Khawas, and he said that you have to write such a text in Persian that we have to amalgamate all the system of Unani medicine to serve our population with excellence, with conservation, with the drugs found here, and with the environment of there. So, and this book also translated 3 times in Urdu by the name of Mujarrabat-e Tibbe Iskandari. The book was written, as I have already told you, by Bahwa bin Khawas, and whatever it is. The next slide is, it shows the existence of the book. One of its printed copy, originally written in Persian language and published in 1877, is available in the library of Ajmal Khan Tibbiya College, AMU, with association number, you can say. The dimension of the text is 19 centimeter to 27 centimeter with the 20 lines on each page, spreading over 492 pages. This is the text. And the second thing is that this is about the translations. There are 3 translations of Madin al-Shifa Sikandar Shahi, written originally in Persian, was made by 3 different people. The first one by Hakim Niaz Ali, second by Sheikh Muhammad Azimullah, and the third one was Sheikh Liaquat Ali Khan. The translation done by Sheikh Liaquat Ali Khan, also printed by the Council, Central Council of Indian Medicine, and this book is very easily available in all the leading institutions of Unani medicine. And the book which I have consulted shows the association number. Next, this is the pictures which I have taken. This is, go back. No. Yes. This is the Persian text, the first page of the Persian text, and that's the translation of that. Published in 1877 from the publisher of Munshi Naval Kishore from Lucknow in 1877. And Urdu translation latest translation was made in 2009 by Central Council. No, Urdu translation. Yes.
No English translation.
No English translation. Yes. It is the Urdu translation. Urdu translation, sir. No English translation is available now. Yet. Now, what is the setup? It is very important. What is the setup of the book? Start with the gratitude to the Almighty Allah and His Messenger Muhammad sallallahu alaihi wasallam, peace be upon him. After covering the medical ethics, this chapter having the definition of Unani medicine with an extensive knowledge about the objectives and basic principles concerning with the practice. Second chapter, it contains 32 topics concerning with the basic principles of Ayurveda about the diagnosis and treatment, foods and drinks, drugs and balancing of the humors with concern with the terminologies in Sanskrit. From here, the terminology starts in Sanskrit. The second chapter belongs to the topic concerning with the formation and development of the body, along with the structural and course of the organs with concerning terminologies in Sanskrit. The third chapter, it contains 87 above or chapters, topic concerning with the signs and symptoms of the diseases concerning terminology in Sanskrit. So the author of another historian known as Abdullah, the author of Tarikh-e-Dawoodi, narrates that this book had confirmed the practice of Unani medicine in India as an indigenous system in our time. This was the beginning of that time. Now, the very important question arises here, that Indic influence in Unani medical texts of the medieval period, why it happened? Either it was due to to cover the deficit of Unani medicine, either the physicians looked into the Ayurveda to cover the deficit, or to practice the Unani medicine in India in accordance to the laws of their medical decorum and required communication skill. And the matching of the color shows that the answer is that they had converted the Ayurvedic text in Persian. Please go back. Yes, to practice the Unani medicine in accordance to the abbot, in accordance to the habitat, in accordance to the habitants, and according to the conservations and the vulnerable conditions found in India. For example, somebody comes and says to the patient that I am suffering from, they will not say that I am suffering from cough or swal. They will say I am suffering from khasi. So to understand the word khasi, this practice was developed. This is the technical need, that why the physician was forced to see and was forced to do academic change in between the Ayurveda and Unani. The first answer is that Unani is a science, and science has no religion and region. So by virtue of the science, every physician has a open mind to elaborate, to extend the text as per the new challenges. So these are the, as my earlier colleague mentioned, that these are the basics asbab sitta zaruriya. But what is there important? That I have shown two factors in blue. These are the factors which are very important, because everybody goes from one place to another with the body, but everybody is unable to shift the atmosphere, the abode, the habits, the surroundings. So our nature has to adjust there. So why it is said that factor number 1 and 2 are external, and 3, 4, and 6 are internal with respect to the body, because the external factors change with the time and space and are responsible to affect the internal factor sooner or later. That's why these factors force the physician to shape the practice in accordance to the above. In India, the physician did the same and looked into the Indian medical text to reframe the practice. Next, please. There are some features of this book. The matter shows that the writer was conversant not only with the Persian but also Sanskrit. By this creation, considerable additions were made in the new view of the Indian climatic condition, temperament, and dispositions of the people, and that Ayurveda was studied in depth, incorporated with foreign medical knowledge. In the book, the Unani medicine is reviewed in the context of Indian climatic conditions, nature of the people, their living habits, particularly their diets and dietary sources are discussed. The text deals mostly with information on hygienic principles and Indian drugs. Some of its distinctions in Indian perspectives are given below. You can say that there are two main things, number one, drug, and number two, diet, which are the factors from outside. Okay, first is the atmosphere. The second thing, what we are taking inside the body. So these are the makulo mashrub, drinks and food. So in drinks and food, there may be two things. What type of drinks and food are available at that time? So at that time, the food and the drugs which were available was quite different as the venue, previous venue, Arabic countries, Persian, whatever it is. So here, drugs were mentioned under the Aushadhi in the book, and the diet has mentioned under the word of Ahar. Ahar and the Aushadhi. And you can see that there are many Sanskrit or Indian names have been translated by the Indian things. For example, there is a drug like Balchad, known as Arabic Insumbulutti. There is a misk, mushk, sont. In Arabic, it is known as zanjabil, suhaga, whatever it is. So these are the names of the drugs which are presented in the book. And conclusion, Unani medicine had taken birth at the soil of Greece, then gradually extended and developed in different parts of the world. In India, it came through northwest zones, mostly by the Muslims. After entering in India, ever the experts had accepted the challenges to shape the Unani practice according to the nature and need of the new habitants. They composed and developed the text based on the knowledge of the Unani medicine and pre-existing Indian medicines. In the result, is stained deeply in Indian character in the sense of remedial assets and conversation with the pupil, and had adopted the local vernacular for practicing. And by virtue of this practice for the centuries, Unani is not foreign. And by virtue of this practice for the centuries, Unani is not foreign now and has become one of the Indian system of medicine. This transformation is the result of Indic influence in Unani medical texts during the medieval period, and Madan al-Shifa Sikandar Shahi is an ample example for the same. Thank you so much. Only 1 minute, sir. Only 1 minute. Switch over to the another, please. And because it is a very interesting topic given to me by you, by yourself. But for the last 2 months, I am preparing this, but I am not leaving this task. I am not leaving this task and prepared some column wise, because a yellow color shows that the process is under process, the work is under process. But even then, I have classified the whole book into the columns. The first one belongs to the simple drugs, the compound drugs, pharmaceutical processes, physical forms of the drugs, instruments, diseases, and functions of the drugs. So I have started out that what type of name has been or have been given to each and every system, and there is a citation with page wise. Okay, upar kariye.
Excuse me, are there the English equivalents to those?
I will insert it later, because it is the first blueprint. So because you know that it is a very challenging and time taking task, and I have to go to the 872 pages. Okay. So I and my researchers of the department are busy, and I'm very sure that in a very short time, you will find a complete blueprint of Madina Shah Sikandar Shahi is with respect to the Indian languages and to elaborate the indigenous system of medicine. Thank you very much.
Thank you, Professor Ashhar Qadeer sir. Now we start with the question answer session, and I see that hand has been raised by Neha Virmani. So first I would ask Neha ji to ask her question. Neha, go ahead.
Hi, good afternoon. Thank you to all the three speakers. These are, and I hate to say this, but these are largely comments on all the three papers combined, because except for the last paper, there has been a tendency to relate Unani to just the Mughals, which is extremely problematic because, as the last paper suggested and showed, that it was being practiced at the Delhi Sultanate, but then we also forget the regional sultanates which came after the Delhi Sultanate. And there's a text by this man called Nagori, which was written at the Gujarat Sultanate. And he actually tries to bring the concept of three doshas in Ayurveda in conversation with the concept of four humors in Unani. And he talks about how they can be synthesized and a hybrid model emerges. And an excellent article on this has been written by Fabrizio Speziale. So there's a lot of work on this interaction between Indic or Ayurvedic medicine and Unani even before the Mughals came into being. The second point I would just like to raise is when we talk about food and medicine and the idea of preservation of health through that, most of these texts make a difference, and they talk about this concept of 4 degrees, where each element or each ingredient acts in different ways depending on the degree to which it belongs. So the distinctions are absolute food, food like medicine, medicine like food, medicine and poison. So it's not a straightforward sort of application of you eat things which are contrary in like if you're suffering from illness which is caused by excess of heat, you eat something cold. So it's far more complicated, and I think that's the problem when we conflate these categories and food just becomes medicine, which was not true. And lastly, this idea that there were no Ayurvedic texts which were written during the Mughal period, or it was just Unani which was being patronized, is actually also again problematic, because at Akbar's court, Todarmal had this big project called Todar Ananda, which was commissioned by him, and Banaras Brahmins at Banaras were involved in it. So like we should be a little careful while talking about these things in very absolute, and like that there was nothing else happening and it was just Unani or Ayurveda was not being patronized. That's it.
Thank you, Neha. I mean, very pertinent points have been raised by you. Before I allow other questions, may I just comment that I think the work which we referred to yesterday, that by A. Rahman and Alavi, they have enough evidence to show that a large number of Ayurvedic texts were, after all, translated and read and commentaries written upon during the Mughal period. Not only during the Mughal period, but even, in fact, before, from 14th and 15th century as well. Tughlaq and Lodi period as well. So Neha has a point, and I think that that should be taken into account. As far as the question of neglect of pre-Mughal and the regional sultanates is concerned, well, once again, the point is well taken. I wish that among the 3 presentations, the one which was presented by Ashhar Qadeer Sahab dealt with a text which belonged to the Lodi period. It's a pre-Mughal period. Unfortunately, you then shifted to the Mughal period to talk about certain things which confused her. But basically, the text which you were introducing was belonging to the Lodi period. I didn't say any word about the Mughal. No, I mean, when you were... Yeah, I will respond. You will respond to it afterwards. And then, Professor Akram was also dealing with the early Mughal period. Yes. So, in fact, the later Mughal period and the period before the Lodis remained unrepresented in these, papers. And Neha has a right to make a comment on that.
So may I respond to?
Please.
Yeah, thank you, Neha, for this wonderful pointing out this. These were not actually shortcomings, and we are not denying it. Basically, in all the 3 presentations, my presentation was limited to the Mughal period. That's why I didn't touch the Sultanate period or the other empires. Second thing which you told about the only Unani medicine texts were developed. No, I also mentioned at some point that Ayurvedic texts were translated, not only translated, but certain new texts were also, developed during this Mughal period regarding the Ayurveda. So, because that was not the, domain of our presentation today, that's why those points were left out. Right. Not deliberate or anything.
Quite right.
Yes, because I have shown it slide containing the 12 books. These books belongs to the early Mughal period. It started from Al-Biruni, then Sultanate period, then Tughlaq period. There is no book in Sayyid period, Lodi period. Okay. And after that, the Mughal period. So that's why I'm taking that in my study, 17 books have come, and I have just tried here to show the 12 books, and there are many books. So because in a short time, I have to focus on my title and the topic. That's why. But this slide is clear evidence that we have a iron on that. And there is a very rich on in previous slide, I have showed that the Unani was introduced in India in 12th century and established in 14th century and soundly patronized by the Mughals. So this is the steps.
So I think that there's a conceptual issue here, and the conceptual issue is that um, do we move away from state-centered framework of analysis when we examine medical traditions?
Mhm.
So I think that's the larger point that Neha is raising, that we need to understand the medical tradition uh, as developing autonomously
Hmm.
and not contingent on the fortunes of the Mughal dynasty, any dynasty for that matter. So I mean that's an issue that need to be taken up. I mean,
Mm, Amol?
Um, Thank you. Again, a very kind of engaging session. I have just two minor questions to Dr. Dr. Dar. One is that in one of your slides, you mentioned that there was a dictionary on medicine, and then it was later on translated in 1870s, if I'm not wrong. Um Republished or translated in 1870. I was just wondering whether this was a response to the European medicine, in the sense that 1870s was a very crucial period when you have the emergence of public sanitary health systems, you have the emergence of Indian medical system, and then you have a few years before you have the 1835 Lord Bentinck setting up the Calcutta Medical College. So was it a response to the European medicine, in a way to show that the European, because the Europeans themselves were trying to look down upon, especially James Mill and others. So was it a response to the European medicine that India, or something that nationalists did later on, that Indian medicine was superior or was this thing? And second question that I have is, since yesterday I was wondering about anesthesia. I mean, we have been discussing about medicines, we have been discussing about injuries, we have been discussing about bone surgeries and all. But what about anesthesia? I mean, that's a very primary thing. If you are in pain, you cannot carry out surgery without giving an anesthesia, local or general. So I was just wondering, and now you have even specialists.
maybe opium served that purpose.
So that's what I'm wondering,
Okay.
because even today you have a specialist anesthesia.
I understood that
Not
question.
any other general physician cannot do an anesthesia.
Yeah.
So I was just wondering that since yesterday there is no discussion on anesthesia.
Let me
So
answer the second question first, because this question is being debated in Unani medicine since many years. Uh, you know, um, Anesthesia, due to lack of the anesthesia, the surgery portion of the Unani medicine was left behind. It was basically the lack of anesthesia. So that's why the medicine portion developed, and the surgical portion was left behind. But there was one in Arab surgeon. His name was Abul Qasim Zahrawi. He was a pioneer in surgery. He developed many instruments which are still being used in the surgery, and they did local surgeries, and they used certain medicines to ease down the pain, but I can't say that it was the real anesthesia. Like sir mentioned, the opium was there, and then there are certain other drugs they used to give to the patient before performing the surgeries. Even the mastectomy surgery, which is doing for the breast, was done by the Qasim Zahrawi. There are evidences for those surgeries, and but yes, and lack of anesthesia was the reason that these medicines were left behind in the surgery area. Now, coming to the first question, the book, the dictionary that was developed, that was written in the Babur period. So for the original dictionary, I don't think there was any European influence. But yes, later translations when they were done, there may be, I agree with you. It may be due to the influence of the Europeans when we were also countering those effects of the Western medicine, bringing the traditional systems down.
Person behind.
I hope you got the answer. Thank you.
Okay. So it should be first come, first served. Yeah, I agree.
Thank you so much, sir, for allowing me. That I have found all the paper very interesting, but still I have some I found some limitations to these all papers, because in terms of the spread of the practices, the the whole discourse over medical practices, how those practices reach to the masses. When it comes to the translation aspect, that sorry, I have worked on Braj literature. So in those poetries, there are several references about the medical practices in terms of no seasons, in with respect to Baramasa poetry. So those knowledges were being transmitted towards the lower level through different kinds of performativity of the canonical text in that I would like to say, and things that what is the bridge that these courtly or that guy's model in study he was showing us, that there is a spiritual domain, there is a courtly domain, and then minors, so masses. So what is the intersectionality through which those information, those medical practices were transmitted to the other labels. So when it comes to the translation, we I find very much interesting about the language of the masses, which is Braj, Avadhi, these kind of things. So in there is a there is these text in Tibet, in any text, or whether it is Sanskrit text, these texts are translated into the Braj literature, or even the Avadhi literature. So I have some reference to that will show that how these things are disseminated to the masses, and which is not confined to the courtly kind of settings only. So can I read one poetry, if I one poetry
There's
related
a
to
shortage of time.
just one poetry? Okay, it's okay. No, I will discuss it later.
We will discuss it
Okay,
later.
okay,
but
okay.
You just pointed
So I
out
just
that there are verses.
there
in
is a
that.
there is a huge gap
Yeah, chalo,
between.
just two verses.
Yeah.
Two.
So there is a translation. So Sitaram Kavi, he wrote a text, Kavi Tarang, in 17th century. देखी तिब साहिब की उपजियो मन आनंद, अर्थ फारसी कठिन ते सुगम बनायो छंद, चरक आदि ते ग्रंथ ले देखे उधमी समान, उन पर सार निकाल के रत्न गहे जिन जान. So he's saying that basically nobody is currently matlab, masses are not understanding either Persian or either Sanskrit. So therefore I have composed these literatures into the Braj masses, Braj Bhasha, which is the masses of the
Thank you
language
for
of the
pointing
masses,
that out. Thank you for pointing.
which is lacking here.
हाँ, सुन तो रहे नहीं.
A beautiful example. This is really the crux of my question. I wanted to put it to all three presenters, and thank you for the very engaging presentations. How do we move from these, let's say, prescriptive texts? And I don't know these texts, so they may well contain a lot more information that is not just prescriptive or description of medicine. How do we move from them, if at all, into the realm of, let's call it in broad terms, community health or public health? We don't need to use either term necessarily, to reconstruct preventative practices that are not some of the things that you described very clearly at the individual level, but that address community. And I think with particular reference, or one gateway that we found for Galenic medicine in Europe and the Middle East is, of course, quality of the air and water, because these are resources and infrastructures that serve the vast majority of the population. But it's not necessarily the only way to get from those texts to practices at the population level.
So actually, being the students of Unani medicine, our main domain of study is the text and the practice part. As far as the public health issues are concerned, we have never left our domain and went there to study what were the practices that time. But I remember an example of the cholera epidemic. Even the British were here in the colonial period, and it was the era when the antibiotics were just being evolved. So they were unable to defend, manage this cholera epidemic in India. But then they, invited the Hakims and Veds in the Indian context, and the medicines which were usually used in India, and those herbs, they were employed in controlling that epidemic of cholera. But as far as those water bodies and other sanitation things, I don't find any, we have not worked on that field.
The concept of Vaba is there in Unani literature, which deals with this type of conditions. Although they were not aware about the germs or the causative organism of cholera, but they knew there is something morbid material in the waters. That is why they divided the epidemic into two parts. One is caused by air and one is through the water. So they had the concept of a certain morbid material, but not due to not, lacking the invent of microscope, they were not able to identify what kind of parasite or what kind of germs are there. But they had some idea that certain morbid material is there, which is responsible for that kind of epidemic. Thank you.
Actually, in the text, the cholera, plague, and influenza had defined in the books. And we had saying in the time of the COVID that the preventive measure, whatever will be the measure, the same which have been mentioned in our books. For example, you have to maintain the distance. You have to cover to your mouth. You have to cover to your accommodations and separations. That is known as quarantine. So these are the things which were available. And the main thing is that the identification of microscopic organisms, their nature, their fraternity, their fate. So we are not stuck on that. These are our no doubt these are our reference books. But by keeping in view, we are keeping ahead with the modern science, modern knowledge, and we are shaping our system as per the need. So as I told you that this is not a stuck knowledge. It is a progressive and will be progressive in future. Thank you.
Any questions from
Yes.
there? No. अच्छा
Any questions from there? No.
Please.
Neha.
Okay, Neha, go ahead. Have you a
Hi.
question?
Yeah, it's about this idea of how the general population was thinking about these medical practices, or what was their awareness. So again, if of course the Mughal texts do not talk. I mean, these are texts produced in a courtly context. But if you look at a lot of 18th century Rajasthani documents, which are caste-based records where people go and petition to the court, you do see a sense of awareness that there is in the general population, especially like different caste groups. And they would also talk about omens and ritualized sort of practices for treatment. And within that, they talk about what were the caste legitimate ways of treating them. So they're not coming out of Unani texts, but what they call Vajbi, and what is the caste sort of permitted way of treating certain disease. And if people are flouting them, they are going and complaining to different courts at different levels. So maybe not in the Mughal context as we understand Mughal court, but in 18th century Rajasthan, there is definitely a sense of masses talking about different disease and what they think are the right ways of treating them.
Mulzab is back. So his worry about anesthesia. In 1830s, there was a British surgeon who practiced in Calcutta, what he called mesmerism. He thought that the Indian body can be easily subordinated. So he would ask his, oh, you are a black man, person and coolie or something, I will remove your thing. You won't feel pain. And the poor fellow would say no pain. And mostly those days was the huge problems of tumors, hydrocele, and so forth. But when this guy returned to Scotland, to Edinburgh, he tried to perform the similar thing on his caught body. He was beaten to pulp. It didn't work. Mesmerism. Okay.
One thing I want to say that for the anesthesia, the ancient physicians were used the opium, extract of the opium, and the alcohol. Today, alcohol known to everyone, but that is a Arabic word, alcohol. Kahal means the thing which is put in the eye, and al is the di. So alcohol. So at that time, when the physician were able to whatever their modes were to treat the cataract, they put the drops in the eyes, and that is known as mukhaddir, anesthetic. Okay, but surgery developed in the masses on the high standard after industrial revolution, because microscope, cannula, industrial revolution, IV fluid, blood transfusion, antibiotic, invasion, and anesthesia. These are the 4 pillars of the surgery. And these 4 pillars were not available even to every science. Either that is Ayurveda or Unani, because this is the traditional longitudinal way of data and research. It is not cross-sectional. Okay, sir. Thank you.
I take this opportunity to thank all the 4 speakers, Professor Farooq Ahmad Dar Saab, Mohammad Akram Saab, Ashhar Saab, for making very interesting interventions in the topic. I am very sorry that perhaps you people, after having worked for such a long time, did not have, I could not give you the time because, we have constraints. And I hope that by the time that the things are ready for publication,
Yes.
we would be getting the full view of what you
Inshallah.
have to say. Thank you once again. Thanks everyone for this session.